Have you ever wondered what's the difference between a surgical vet nurse and a medicine vet nurse?
Hello, my name's Carly. I'm one of the surgical nurses at the Animal Referral Hospital.
Animal Referral Hospital Canberra's Carly Wilson explains.
So medicine patients are often a lot more difficult to deal with. So surgery I like because basically what my day consists of is animals coming in that might be needing elective surgeries or emergencies. We're responsible for anaesthetising them, taking x-rays, other sorts of radiology, taking them into surgery and then their recovery afterwards, bandaging, checkups, that sort of thing. Whereas medicine is more ongoing cases, maybe, diabetics or, pancreatitis, things like that. So ours are a lot easier to fix mostly.
It sounds like it should be the opposite. But,
yeah, that's
very
it.
interesting, very interesting. All right. Well, look, I want to find out what people are doing outside of work. I think we've done a lot of stories on vet nurses and vets, working. But what do you do outside of work? What are your passions? Apart from computer games, you told me.
Okay, well, I'm a real introvert, so I don't do a lot of, outsidey things. But I think the one thing I do spend most of my time attending to outside of work is I keep a marine fish tank. So that's very fun. We've got some clownfish in there, some other sorts of things, some corals. We have an anemone, which our clownfish live in, which is very cool.
Anemone.
Yeah. So no, it's very cool. It's a lot of hard work. There's a lot that goes into keeping a fish tank. So.
Yeah. I think hopefully long gone are the days where people got a round bowl with nothing in it and just put goldfish in it.
Yeah, it makes me cringe a little bit. I did that as a child with goldfish, and that was never a problem. But keeping marine in particular is quite a bit more fiddly. There's a lot more time involved, and obviously the things that you're buying are incredibly expensive sometimes, as opposed to a $20 goldfish, you've got a $120 fish from Queensland sort of thing, and particularly because a lot of the corals in Australia in the aquarium industry are taken from the reef. So in America there's a lot more aquaculture going on. It's a much larger industry. There's a lot more people growing, so they don't have to take so much from the wild. In Australia it's still sort of in the beginning, so there's only a few people starting to aquaculture corals and things like that.
Okay.
So it's puts a bit more pressure on to really take care of them, because you don't want to be taking something from the wild and then letting something happen to
Absolutely.
it. So
Yeah. What about a tip for potential fish owners? Now, you've got marine fish, but if someone said, I'd love to have a fish tank, what would be the starting point? I think marine are a bit more difficult, aren't they?
Yeah, a little bit more difficult. Probably start with something a little bit easier, like freshwater or even tropical freshwater. The biggest thing really is to research. Don't impulse buy, and nothing good happens when it happens fast as far as fish tanks go. So, not a lot of people know about cycling in aquariums, so talking about having good bacteria to help break down fish waste and things like that. It might seem as easy as, going and getting a bowl, filling it with water and throwing in your fish and away you go, but it's not always quite that easy. There's some chemicals, there's some testing involved. So.
Well, they defecate in the very water they swim in and breathe and all the rest of it.
That's exactly right.
So you can't just go on a 2-week holiday and forget about it.
No, absolutely not. No, it's always worth having someone, popping around to take care of them at least. So
Okay, fantastic.
having a backup plan.
Alrighty, well, that's some good information for people. Thank you. I can see you're very passionate about it.
I love my fish.
Thanks, Carly.
No worries.